Risk management in the healthcare system. What are the potential risks faced by patients and staff? A health risk manager will join me in less than a minute to discuss this. Later in this program, you'll hear New York Police Officer Joseph Robinson talk about young people, and he meets with them 2 days a week. He mentors them, he coaches them. We'll be talking about all this and how all this benefits the community. Now, we start with managing health risks. Liesl Grant, you are a health risk manager. Welcome to Brooklyn 45.
Why, thank you, Sam.
What should our viewers know about health risk management?
So health risk management is something that a lot of people are not familiar with. And so I will tell you that it encompasses medical malpractice insurance and patient safety. And it also encompasses the safety of the employees within the healthcare system. So as a risk manager, my role is to identify, assess, evaluate, and look into unexpected events that occur both with patients and with staff within the hospital.
What are some of these events that are unexpected?
So from a patient point of view, it can range from anything from a medication error to actually having surgery on the wrong site. So it's a wide range of events that could occur, but it is literally something that the patient comes into the hospital for, and then something else happens. And so my team, we investigate the unexpected, the thing that was not supposed to occur while that patient was in the hospital.
Talk a bit about patient rights. What are the rights of these patients?
So there are a lot of rights that patients have, but I will tell you, they have a right to safe care. They have a right to know who the providers are that are taking care of them. So we all should be wearing our IDs every single day. They have a right to have translator services if English is not their first language. So there are a lot of rights that patients have, and they have a right to informed consent. So they need to know that they're making appropriate decisions because we provide them with appropriate information to make those decisions.
When do they get this information?
On admission to any healthcare facility, it's usually posted within the facility, but as a patient, you should be given a copy of your rights so that you could have those with you and refer to them if you're concerned about the care that you're receiving.
Do they have advocates?
Absolutely. I work very closely with those advocates. So depending on the institution, they're called patient advocates, they're called patient relations. Sometimes it's patient experience, but there's always someone there who represents that patient. And if the patient has concerns, they can reach out to that person. They get the information, and then that person will contact risk management and let us know if it is an adverse event.
That person could be family?
Yes. Yes. I come from a very large family, and, I know if I end up in the hospital, they will be all over the hospital. Security will be please stay in the lobby type thing. So yes, it could be a family member because we do have, a lot of vulnerable populations and elderly people who depend on their children or their grandchildren or their spouses to assist them with their health care. So yes, it can be a family member who's reaching out to us.
And do you and other risk managers meet with these persons?
Absolutely. So it's one of the things that I do enjoy doing is, meeting with patients, going to them, listening to what they have to say, because what they tell us will help us to look for opportunities to improve the care that we're giving them. This is what we need to hear. We need their feedback. We need to know, what their perception is of the care we're providing. And this is how we make things safer for them. Because once they give us an idea of what it is they have concerns about, then we can look into it.
Planning is very important. And I don't know if a lot of patients you are in contact with do the necessary planning. Um, talk to
You hit the nail on the head, Sam.
us.
So my office gets quite a few calls from the nurses, from the doctors who are concerned that a patient may not be able to make decisions for themselves, meaning they don't have the capacity to do that. And now the question is, who can make decisions for them? So in an emergency situation, two providers, two physicians, two NPs, two PAs, two providers can come together and deem this to be an emergency and document that, and they can make decisions for that patient. But that's only in an emergency situation. Once the patient becomes stable, it's no longer considered the emergency. We need to find someone who can make decisions for them. So if you're smart, you plan ahead and you do what's called a healthcare proxy, meaning you, as the person, select someone to make decisions for you should you get in a position where you can't make decisions for yourself. That's the best thing to do. I advise anyone over the age of 18 to do this. You don't have to be sick. You don't have to be elderly. You don't have to be end of life. It's a good thing to do because unfortunately, you could be walking down the sidewalk, trip, fall, lose consciousness. Who will make those decisions for you? So it's always good to plan ahead. If you don't plan ahead, we have something called the Family Healthcare Decision Act that gives us a list of what they call surrogates, starting with guardians, spouses, and it goes down the list through children, etc. And the last person on the list is called a close friend. So that's when we've exhausted everything. Now we get to a close friend. So what you don't want is someone being selected to make decisions for you. So it's always good for you to do your healthcare proxy. You choose who you want to make decisions for you. Always the best thing to do.
You mentioned an act just now. What is
Yes.
this act?
So the Family Healthcare Decision Act allows for someone to make decisions for a patient who may not have the capacity to do it for themselves. And because of this act, it does help us because when you don't have anyone there, you may be out on the street somewhere and you don't have a family member with you. You come into the hospital. We now go in search of someone to give you that support and someone that we would have to choose. And this Family Healthcare Decision Act is like almost like a Bible for healthcare providers because it gives us guidance on who we can select, who we can go to help you to get better. So it does give us a beautiful list of what they call surrogates, meaning these are people that are now being selected, and this law allows us to select the people on that list to help take care of you.
Do you discuss this act with patients, older patients, younger? Because you mentioned just now, some patients could be in the early 20s. They don't
Yes,
have to be old.
absolutely. So on admission to the hospital, and even if you go to a clinic or any type of healthcare facility, part of your registration process should be them asking you, do you have a healthcare proxy? Who is your emergency contact? Who can we contact? Right? In the case of an emergency. So it's a discussion that happens everywhere and all the time. And people don't really know that that's what it's called, the Family Healthcare Decision Act. That's the reason we're asking you these questions. But yes, on admission to a hospital, they'll ask you, do you have a healthcare proxy? Would you like to select someone at this time? Because that's a good time while people are awake and alert to say, would you like to select someone, who can make decisions for you? And we do have the paperwork. We can have them fill out the form, right there, right then. If they're unable to fill out the form, but they're still alert enough to tell us, then the form gets filled out and it's documented that the person verbally in in the presence of witnesses, stated that this is who they want to take care of them.
You mentioned hospitals.
Yes,
You also mentioned that there are other facilities. What would
correct.
these other facilities be?
They can be clinics, which a lot of people go to. They can be private, physician practices. Even when I go to my dentist, the first thing they ask me for is an emergency contact, right? They need to have somebody there that they can reach out to in the event of an emergency.
Okay, so
Yes,
any healthcare professional.
correct. Any healthcare facility should be speaking to you about an emergency contact person.
What are some worst case scenarios that should alert people, that may scare people, but that people need to be aware of?
I think the most common, not necessarily the worst, the most common one is a medication error,
Is a what?
where medication error, right? Where someone may have gotten the wrong medication. They may have gotten it through the wrong route. Instead of them getting it by mouth, they may have gotten it through an IV or vice versa. Those are the most common ones we see. The worst case that I have seen was a foreign body that was left in a patient during a surgical procedure.
Mm.
Yes, yes. And that was a pretty big investigation because you always want to know why would something like that happen. So it's you speak to the staff, you go through, did we follow our process? Did we follow our procedures? We always have to look to see, are we doing what we're supposed to be doing? And if there were any deviations, why those occurred? And then we look for opportunities. How do we improve it? How do we change it? How do we prevent that from happening again?
Now, you work with a group of people. You are a manager. Are there other managers in other healthcare facilities as well? Do you manage other managers?
Well, I am the director for the program that I have right now. So I do have a manager under me, and we have a team and we all work very closely together. But yes, other facilities do have risk managers. They do have a risk department. The majority of them do have risk managers that do what I do, which is what I consider clinical risk management, that portion that looks at a lot of patient safety, a lot of staff safety. And then there are others who look at the litigation side of things, the medical malpractice piece, where they really review potential claims, possibility that this case may go to a lawsuit.
So you work with legal teams as well.
Correct. Yes. Yes. If we determine that something could possibly lead to some kind of a claim or litigation, absolutely, we reach out to our attorneys, we reach out to our insurance company.
Okay. You agreed earlier. In fact, you stated that a lot of people are not aware of risk management. Why do you think people are unaware? We expect older people to be aware.
Yes. So, I would say people are very familiar with, as you said, patient advocates, right? And so the patient advocate is really the face that they see because those people are sometimes on the units working right there. They're the first access that many patients have. We tend to be a little more behind the scenes. So we're not advertised the way patient advocates are advertised, but we're still here to help patients. So there's a connection that goes from that patient advocate over to the risk department. Can patients contact us directly? Absolutely. Because they do have patients out there who are familiar with what risk management does, and they will contact us, directly. So I would say to, anyone out there, be aware that every hospital does have a risk department. Actually, risk management isn't just for healthcare. We have high reliability organizations like the military and, the aviation areas. Those areas have very huge, very large risk management teams because they look at the same thing. They look at safety. So just about everywhere, there's a risk management team. And we might be a little bit behind the scenes, but we're there working to make sure that everybody's safe. Our ultimate goal is zero harm.
Liesl Grant, Health
Yes.
Risk Manager. We thank you for the information you have
Thank you.
provided on Brooklyn 45. And is it okay for people to contact you directly?
Absolutely. They can contact me directly. And, I will be happy to speak with them about their rights, about their ability to select a healthcare proxy, and give them more information on the Family Healthcare Decision Act and what, occurs if you don't select someone.
Okay, Liesl Grant. Thank you for being our
Thank
guest on
you.
Brooklyn.
I appreciate you having me on. Thank you.
Okay, well, we appreciate your providing the information that you have provided. Thank you.
Thank you. Bye bye.
Police Officer Joseph Robinson, welcome to Brooklyn 45.
Thank you. Thank you for having me.
Well, we're not talking to you as a police officer right now. We're talking to you as an officer who is mentoring young men. What's the ages of these young men?
The ages from these young men range between 13 and 18.
13 and 18.
13 through 18.
Okay, so these are teenagers.
Teenage boys. Yes, boys and girls.
Okay, boys and girls.
Yes,
How
sir.
long have you been doing this work with these teenagers?
Well, I've been working with the Blue Chips program. That's the name of the program. I've been working with this program within the NYPD for about 6 years now.
Tell us about the Blue Chip program.
This program is like I would say, it's like a mentor program. So what we do, we get a group of kids and we basically give them something to do. We do sports with them. We mentor them. We take them on field trips, and we do community service. So this program right here is good for a wide variety of things. This prepares these kids for life, prepare these kids for college. Um, these basically we're like older brothers and sisters to these kids.
How do kids become interested in this program?
So our method is basically to try to influence them to play sports. So in anything that we do, we try to make sure we provide some fun for the activities for the kids. So we try to lure them in with the sports, and once we get them in, we take time to actually speak to them, get in part of their life, and things of that nature.
Do you work with their parents as well?
Yes, the parents are very close knit, and a lot of parents that I've been dealing with, they love the program. There's a few kids that probably had problems at home and problems at school, and a lot of parents are very satisfied with the program because we also help the kids get tutoring. It's just a great program overall.
How many kids participate in this program?
Um, I would say it's about roughly 500 kids if you was to add up all the different boroughs and different precincts that have kids participating. Probably over 500 kids right now, but it could be more.
Now, do you meet personally with these 400 or 500 kids?
No, see, it's me personally. It goes. See, there's quite a few precincts. I would say roughly out of all the precincts, probably like 20 precincts participate in this blue chip program. So I work in Brooklyn South. So for my group of kids, depending on the season we in, right now we in flag football season. I would say I meet with about 15 to 20 kids per week.
You help keep these kids from getting into trouble.
Absolutely. Absolutely. That's my main goal. That's my main goal is to keep these kids busy, keep them occupied, keep them motivated, and keep them out of trouble.
Mhm. Early intervention is so very important. Uh, is this how you contact these kids and how you reach out to these kids? And is this a message that you give them?
Yes, absolutely. I'm a firm believer in early intervention. And how I, get to meet these kids. Sometimes I go to the parks. Sometimes I go down to the schools in my precinct area. And I recruit them. I come there and I come there with my brochure and I put a table out and they come over to me asking me what's this program about, and I encourage them to join.
Do they have relationships with other police officers?
Absolutely. When we meet up to conduct games, the other blue chips coaches who's police officers, they're there with their kids, and everybody's like intertwined like a family, you know. So they definitely build relationships with other officers as well.
What kind of tutoring do you provide with this Blue Chips program?
Can you repeat that question?
What kind of tutoring is provided for these kids in the
Oh,
Blue Chips program?
what type of tutoring? So this is what I do. I I'm very hands on with all my participants, all the youth. So the youth that's a little bit older than the younger youth, especially the ones that's A students, what I do is if any one of my youth is struggling, I have my older youth tutor them. So we had a situation like that probably like a year ago. One of my youth was failing a certain subject, and then I had an honor roll student who was on his way to go to college. So I pulled him to the side, and he was struggling. The younger youth was struggling in math, so I had the older youth basically tutor him and help him, and he ended up passing the class thanks to the other kid.
Let's talk about sports. And
Yes,
kids are interested in sports. What
yes, sir.
kind of sports do you work with these kids on?
Yes. So we do basketball, we do flag football, we do volleyball, we do track and field, and we do baseball.
You play all
Yes,
of these sports?
yes, I do.
What's
And,
your
and
fa- what's your favorite sport?
oh, out of all of those sports, you'd be surprised. Flag football. Flag football is a very, very, very fun sport.
Mhm. Now, which sports do these kids participate in, and which sports are they most interested in?
I would say the sports that they're most interested in is between flag football and basketball.
Mhm. Are they ever able to represent their schools in these games?
Yes, absolutely, absolutely. They represent blue chips as a whole, obviously, but a lot of these kids come from different schools, and yeah, they represent their schools from time to time.
Okay. Which schools, uh, which schools do they represent? We have basketball, we have football. Are there any schools within your precinct where these kids are able to play for their schools?
Yes, absolutely. The group in the school in my precinct area is New Utrecht High School, and they represent that school. But then we also being that blue chips are so broad, we bump into different schools like Tilden High School, Canarsie High School, Midwood, all
Mhm.
these various, we got, like I said, we have so many various students that participate and stuff like that in this program. So it's refreshing.
Now, you say that this program, this Blue Chips program, is sanctioned by the Police Athletic League. Tell us about the Police Athletic League.
Yeah, so basically, this Bluetooth program is actually, I call it sort of say PAL, which Police Athletic League on steroids. Um, it started out as PAL. So PAL used to be a thing where the youth in the neighborhood can come to a location and enjoy activities. We took it up a notch, and we don't just designate ourselves to one location. We actually step out and do broader things. We go to different locations. We link up with different organizations to do different type of activities and in community service and things of that nature. We also take them on field trips. We take them to New York. Shout out to the Brooklyn Nets. We take them to the Nets games. Anything that we can basically get our hands on to get these kids involved in, we try to do.
You have to split your time between your job as a police officer and working with these kids. How do you manage that? And how much time do you spend with the kids as opposed to working on your job as a police officer?
Yes, yes. You know, it's I love it. I love it. It could be time consuming, but this is something that I love to do. So that doesn't really, feel so, time consuming to me. Even though it is time consuming, but I love this. This is my passion. I love working with the youth. So basically the time that I'm with the youth 2 days out the week, and the other three I'm on patrol.
Well, you enjoy working with with these kids,
I
and
love
I have to say that you look like a kid yourself.
Thank you. And I'm 40 years old, man, and that's a compliment. That's a real
Wow.
good compliment. Thank you so much. And I got carded the other day, and I said, wow, man. I said, God is good. If I could be 40 years old and get carded, that's a blessing.
Thank you, Police Officer Joseph Robinson,
Thank you
for
so much.
sharing the information that you have provided for us.
Thank you so much. I appreciate you guys. Thank you so much for having me. And shout out to the Blue Chips program. And I encourage all the youth out there, if you're interested in joining the program, please go to your local police department.
And to you, our viewers, we thank you for watching this program. You can watch it also on our YouTube channel. We invite you to support and partner with Brooklyn 45. We are a 501c3 community television program. So when you support us with a donation, you benefit, and our communities benefit as well from the information we provide. Please tell your family, your friends, and your work colleagues to watch Brooklyn 45 TV programs on cable television and on YouTube, and to support and be a part of what we do to keep Brooklyn 45 going. On behalf of our team, I'm Sam Taitt.
Brooklyn 45 is a 501c3 not-for-profit, and we welcome your support. Check out our website, brooklyn45.com, and feel free to donate or share it with your friends and family. Have any comments or questions? Send them to our Facebook, facebook.com/brooklyn45tv. If you have any questions or topics you think we should cover next, shoot me an email over at brooklyn45tv@gmail.com. Thank you again for watching.